Welcome to this week's food service grocery restaurant call, part of a series of regular calls where we'll be offering opportunities for you as businesses to ask questions about the orders as they exist now and as we move forward, provide some feedback, and to really have a presence at the table so that you can get your questions answered, really. We are welcome today alongside Boulder County Public Health to discuss next steps, if they're available, and really to reiterate some of the previous comments and requirements that have been listed in previous webinars. My name is Corinne Waldow. I'm with the Boulder Chamber. I'll be facilitating Q&A today, so if you have Q&A, please put it into the Q&A box. I'll try to capture it in the chat, but it's a lot easier if it's in the Q&A. I want to thank Boulder County Public Health for making time every week to kind of be at the table with you and to answer those questions. And I want to thank our fellow chambers and economic development partners for helping getting word out about opportunities for businesses to participate in these calls. I'm going to pass it off to Zach Lustgarten with Boulder County Public Health.
Thank you, Corinne. As Corinne said, my name is Zach Lustgarten. I work in the food safety team here at Boulder County Public Health, and I'm going to present today some of our response here with COVID-19 and what we're looking at for safer at home as it relates to grocery stores and restaurants. So today, we're just going to do a quick overview of the face covering mandate that has come into place on May 9th here in Boulder County. And we'll talk about safer at home, resources that we have to support you, and then we'll open it up and give you some opportunities for Q&A. So the long-term outlook of COVID-19, we're not going to be in a new normal until there's a vaccine that has treatment and we have a herd immunity within our community. So safer at home took effect May 9th. And we do see that this will evolve if these tactics are successful. And we foresee that May 26th will be a date when some other decisions will be made about next steps. But it's important to note that it's going to be a long process, and there's not an easy re-entry for this sector. So the face covering order went into effect, like I said, May 9th. What the order actually says is that within Boulder County, if you're outside of your home and you're within 6 feet of someone, you should be wearing a face covering. The exceptions for the face covering would be if you do not feel safe wearing the face covering. In other words, you have a medical condition or mental health condition that would prevent you from wearing it. If you are alone, so this would not pertain to our retail food sector because we're within a business and we would want to wear a mask in that situation. But if you were in a park or something like that, then there was no one around. Or if it's a child under 12, they're not required to wear a mask or a face covering. Safer at home. So also on May 9th, Safer at Home took effect in Boulder County. What Safer at Home means is that we're still attempting to stay home as much as possible. COVID-19 is still contagious. We are open under the same situation for groceries and for restaurants as we were starting March 27th. When we went under the Public Health Order 2022 that closed our dining rooms. So there isn't a lot of change in this sector, and that's important to note as we're in this stage. This is new territory for all of us, and we are open to suggestions from this sector, from our business owners, and we're looking for best practices as we move forward into these next stages. But it is important to note that the restaurant industry specifically is a point of high exposure, and that's why our dining rooms in this stage of safer at home are still closed. So this webinar is for our restaurants, our mobile units, grocery stores, markets, and convenience stores. So we've taken two webinars and really put them together here because not much has changed in either one of these sectors. So we're hoping that we can field all these questions together, and we'll have this webinar each week at 1 o'clock on Tuesdays. Timeline, as I stated earlier, the stay-at-home order took effect on March 26th. On April 24th, the stay-at-home order was extended here in Boulder County. And then on May 9th, our county face covering order and safer at home were enacted. So that's where we're at right now. What comes next? Speaking of safer at home, it will be reevaluated on May 26th. And we're looking for more guidance from the state and from the governor. And if anybody tuned into his press conference yesterday, guidance and information should be coming in that week that precedes the 26th. So safer at home, what retail food industry can do. So let's break it down into restaurants and groceries. Under restaurants, we are still closed for dine-in service. You are still able to do delivery service, window service, walk-up service, drive-through service, and drive-up service. So that's it. Some questions have flooded in about outdoor seating under this order. Nothing has changed in that realm. So we are still not offering outdoor patio seating or indoor seating. Grocery stores, again, nothing has changed. We've been an essential service from the beginning with grocery stores. So under safer at home, there are no changes, but we just encourage all of our groceries to follow those best practices. So speaking of best practices, here is a slide that shows you, it's from the FDA, that breaks our best practices for retail. There's a little bit of grocery in here, but mostly restaurants. And it breaks it down into 4 categories: be healthy, be clean, clean and disinfect, social distancing, and pickup and delivery. So these are best practices that we will look at as we go forward. And this was kind of the basis for what we created on our checklist that we'll talk about a little bit later. And the checklist, yeah, again, we'll talk about that length. Just some highlights here. Be healthy, be clean. We're talking about folks not working when they're sick here. Washing your hands often, using hand sanitizer. And then obviously in the food industry, we're always washing our hands often and not where we're separating raw and ready to eat foods and cooking foods to the appropriate temperatures, things of that nature. So basic food safety principles. Clean and disinfecting, sanitizer on all your food contact surfaces, and disinfecting these high touch non-food contact surfaces such as door handles and things that your hands are going to come into contact with often. As always, we just follow EPA guidelines on your label for these disinfectants and sanitizers. Social distancing, again, we'll talk about this a little bit more as we get into the checklist, and pickup and delivery. Again, I'll talk more about that. But this is just a good infographic that you can find at the FDA's website. It's good for just hanging up in your facility and to assist you with these steps. Important to note that Boulder County Public Health cannot provide legal advice. Compliance with these orders is mandatory. And as we go through these steps and these phases, it's important to note that we're going to try our best to assist you. But if you have additional questions about compliance and your specific operation, we would recommend that you contact an attorney, especially if you're a very specific type of business that might have some just nuances that other folks might not. Wanted to go over some common Q&A questions that we got at our last session. The first was, when can dine-in services resume? Again, going back to that timeline, we're looking at May 26th for a decision on what next steps look like. But under safe at home, until May 26th, we are looking at no dine-in services for restaurants. Outside dining, is it permitted? As I noted earlier, it is not at this time. How many people can be in a restaurant at a given time? We're looking at groups of 10 or fewer in just general public, and 5 or fewer within, oops, sorry, little guy here. No, come on. So how many people can be in a restaurant at a given time? The recommendation is 5 or fewer for to-go orders, but 10 or fewer in gatherings in general. So the outdoor gatherings, such as special events that are catered or permitted, they are permitted if they're 10 or fewer folks together. So that's just straight out of Safer at Home order. Are employees required to wear masks? Yes, they are. That is not spelled out specifically in the facial covering order, but it is spelled out under previous orders where it says all essential businesses need to, or essential employees need to wear facial coverings. So the answer is yes, and that includes all the folks in your facility. So front line, back line, cooks, etc. Are restaurants required to enforce customer masking requirements? So what we would like to happen is absolutely, we do not want folks entering your establishments without masking. What that masking looks like, again, there's exceptions to the rule if we have children under 12 or there's a medical condition that would prevent someone from wearing a mask. Understood that this is a contentious issue. We just ask that you put the signs up and you ask for compliance. Past that, law enforcement is available to you. And again, never put yourself in harm's way if there's a contentious situation. And then finally, when will guidance be provided for dine-in? We're actively working on this as we see different counties and states lift orders and moving into that next phase of dine-in. We're looking at what kind of guidance is coming out. And so we're working with the state and other counties in the Denver metro area to create this guidance. We don't have it yet. This is, again, several weeks off, but that should be coming as we know more from the state. Where to go for information? We've just put several links here. And again, this webinar is being recorded, so you'll have access to these links. The Chamber of Commerce, Small Business Development Center, industry associations specific for you. I would look into the Colorado Restaurant Association. They have a reopening guidance document that provides, again, it's just some basic stuff, but we'll have more as we go forward. So we created compliance checklists for the grocery industry and for the restaurant industry. And these are designed as a compliance aid and a communication tool for our local businesses. They do come with a poster that would be mailed out to you should you meet all these checklist recommendations. And it's something that you can put in your window to show patrons that you are doing your due diligence, that you're doing your best to comply with everything that the state is requiring of you. Compliance with the public health orders, mandatory. The use of the checklist is voluntary. That's an important piece. So what's in these checklists? First, we'll start with restaurants. We're gonna break it down into workspaces, employees, and customers. Under the workspaces, we would ask for signage to be posted on your door that would inform customers that if they are sick, they may not enter, that they need to be wearing facial coverings to enter, and they need to comply with social distancing requirements. The other things that need to take place as under Safer at Home, this is important that it's under Safer at Home. So this is all going to relate to that. That you close down all indoor and outdoor seating, as I noted earlier. It's for curbside and pickup only. That's all we can do under Safer at Home. We recommend that you have staff outside during peak hours that usher in patrons if they are picking up. We recommend curbside, but if you are allowing folks to come into the facility to pay and to take their order, then we ask that you have some staff outside during those peak hours to assist them with their entry and exit, and just to make sure that we're not going over that 5 recommendation, or that recommendation of 5 folks being in there at a time. Limiting access to one door. This came up last time. It's not that we're not talking about locking all the doors. We're talking about signage here, encouraging folks to just use one-way traffic, in other words. Physical barriers at the payment area, talking about like a plexiglass situation or some type of separation between customer and cashier. And then floor markers. This is kind of old hat at this point, but we're marking 6-foot distances to encourage the proper social distancing. Moving on to employees checklists. Important that we're taking temperature checks. Again, recommendations, but these are things that are going to help you prevent COVID from entering your facility and you becoming a spreader of this disease. So temperature checks of your employees, wellness screening of your employees, gloves and masks. Gloves are required for ready-to-eat foods and anyone that would be exchanging money or forward-facing, customer-facing, but it's just normal retail food at that point. We wear gloves with ready-to-eat foods, right? We know that. Frequent hand washing, as always, and using hand sanitizers with at least 60% alcohol content. We recommend staggering your shifts so that necessary personnel are in the facility, and that's it. And then frequent cleaning and sanitizing. As always, we're sanitizing our food contact surfaces as we use them, and disinfecting those high contact surface, high touch contact areas. Customer checklist, again, the signage and the markers to promote social distancing. We are now requiring facial coverings as of May 9th, 5 or fewer folks in the store at one time, and then just obviously encouraging order ahead or curbside and delivery options, cashless options. The less handling and exchange that you have, the better. Moving on to groceries. Again, this has been in place since March 26th, and most of our groceries are doing a great job of this, but they're going to follow guidance for all businesses, number one. Number two, the spacing, so inside and outside of the store. If you go to a grocery store and you see long lines outside of the store, it's important that even in those situations, we have markers in place to prevent people from bunching. The spacing tools, like I'm talking about, are tape markers. That's what we most often see. Physical barriers, what we are seeing there, we're recommending plexiglass or sneeze guards in those groceries that had hot and cold buffet areas. If they're not just doing away with those, then they have to be non-customer self-service, right? So this, again, recommendations, but this is going to go a long way to preventing any kind of spread of this illness. It is person to person, but those surfaces are just high contact surfaces. So if you do have a hot or cold buffet in a grocery store, we would be looking for that to be staffed. So you have folks that are monitoring it, and the recommendation would be that it's not self-service. Moving forward again with more workspace checklist, because in a grocery, that's mostly what we're talking about is workspace. Signage, again, like I said, same as the restaurants, including physical distancing, good hygiene, sanitation practices, and then the facial coverings. Placing hand sanitizers in convenient and accessible locations, and sanitizing wipes near like grocery carts where folks are going to be grabbing their new grocery carts. We often also see a designated sanitation worker here that is continuously cleaning and sanitizing those surfaces before a customer even comes in. And then illness. that you're requiring employees to stay at home when they're showing signs or symptoms of illness. And that takes us right into the employees checklist. Masks and gloves are required at this time. Wellness checks, highly, highly recommended. And we have some links here to some CDPHE resources, the daily temperature check and monitoring system that they have in place, and then a symptom tracker that you can send on to the state if need be. We recommend the staggering and altering of shifts again, so that there's not too many employees in the store at once, and that you are limiting exposure for employees that are higher risk. So if we have a vulnerable employee, finding maybe an alternative work that they can do other than forward-facing, customer-facing position. All right, so enforcement. We're asking for voluntary compliance. My new role, or my role under COVID, is under a business team liaison. And our job is essentially, when we're getting these complaints that come in every day, we're going to contact your business and we're going to inquire and educate, and we're going to do our best to help you comply with all these public health orders. There's a lot, it's ever changing, it's evolving. So that's what we're here for, is to assist you and making sure that you're compliant. But if we have some issues, the first thing that we're going to do is say, have you checked out our checklist? And if you have, then you can be proactive to prevent issues from coming up. There are always the possibility that we could move to civil action or orders to close. As you saw in Castle Rock yesterday, a restaurant just did not comply with the state's orders, and they were asked to close by the governor. So that's the kind of stuff that could happen, and we never want to go there if possible. Just wanted to highlight these sessions will be weekly. You can see the food service is at 1 p.m. And then we have all these other sectors that are opening now as well. And so we're offering these each week. And there are sessions in Spanish on Wednesday at 6 p.m. So with that, I'd like to open it up to Q&A. Anything that, that we can assist with or that have come through the chat, we'd like to open it up at this point.
Thanks, Zach. In just a minute, I'm going to share my screen and show the signage that was created in both English and Spanish to give folks on the call an understanding of some of the signage that's available to help with the education and to comply with the orders. We had a couple questions come in while you were on. Will these webinars also include information about catering, or could you give us more information about catering? Obviously, we're not able to operate yet in our venues, but we'd like to know what is coming up for us too.
Yeah, I touched on it just at a 10,000 foot view, because that's really all we know at this point, is that under Safer at Home, we are limiting group gatherings to 10 or fewer. So if there are catering events that are occurring, they would have to be for small groups that would be meeting that number or lower. So what comes next, that is something that that we're working on, and that we're looking for guidance from the governor's office. And if Lane, you had any other insight, let me know.
Well, maybe you could give a couple, Boulder Chambers, we cater a lot of events. So we see, are there maybe some menu items that, caterers should, maybe not this, the past hors d'oeuvres, or are there some things they should think about to be safer in these times?
At this time, there's been no link from COVID-19 to food. It's not seen as a carrier. Like I said, the primary way of spreading this disease is person to person. So we're preventing those group gatherings. Follow normal practices. I would stray away from uncooked, ready-to-eat food. Those things are always a potential for foodborne illness. I think that your menu should definitely be pared down to essentials, right? Like you don't want to have too big of a menu, but there's nothing that specifically says that this disease is associated with food. So that shouldn't be a risk, and that shouldn't be a worry for your business.
And I would just offer that buffet style service is probably not in your best interest, similar to what we're trying to exclude at grocery stores, that those frequently touched utensils that are shared across multiple people are a concern. So that's not the best way to try to set things up. But outside of that, we're still under that limitation of people. So it certainly is going to limit the types of events you're going to be able to cater until we are moving to a next phase.
And Lane, speaking of limitations on people, like we got this question a ton this week for across different industries. That 10 includes staff or not including staff?
If the staff were attending the event and serving the food, it would include the staff. If they're just dropping off the food and leaving, the event could have 10 or less people.
So we have a question about temperature checks. Am I understanding correctly that temperature checks are required, I think more along the employee side? If you could better clarify that and give a little guidance as to what some of these health checks include.
Yeah, so when I'm referring to temperature checks and I'm referring to wellness checks, those are things that we put on our checklist as best practices. Nowhere in the order will you find that that is required, to my knowledge, and jump in if I'm wrong. As again, these are ever evolving. But temperature checks, this is all going to be proactive stuff that's going to prevent you from allowing anybody that is showing signs or symptoms of COVID-19 to enter the facility from your staff.
But other industries are requiring it. So if someone in the restaurant industry hears about office taking temperature checks when people come in, or personal services, those industries are required per the Safer at Home order, correct?
Yeah, those are called out in those. Each sector has its own specific components. And since the grocery and retail were not addressed with any specific changes in Safer at Home, they aren't called out. But I think it is in everyone's best interest to look at those best practices and do those things. So that the employee illness is one of your biggest risks in general for foodborne illness, and it continues to be that for COVID. So having those potential outbreaks is going to be really detrimental to the industry. So it is really important to be screening for wellness just as part of our retail food regulation requirements.
Thank you, Lane. Is Boulder County planning to follow the state guidelines in terms of dine-in opening and rules restrictions, or should we expect Boulder County to set their own timetable and set of regulations?
I don't know if we can answer that since we have no idea what the state's guidance is or when they're planning to do things. And it's really dependent on what our surveillance data is saying. What does it look like for our rates of disease, and specifically hospitalizations and critical care patients? So without seeing any of that information, it's really impossible for us to answer that. I think our goal has been to continue to align with the state's requirements. That's what we've done right now for Safer at Home, except for the time of when it was launched, which was premature. Outside of that, I think our goal is to try to follow the state's requirements, just maybe the timing, depending again what gets announced.
To follow up on that, can individual cities loosen restrictions within those cities on their own?
No. The cities have authority to be more stringent, which we again don't encourage the cities to impose any restrictions beyond what public health is already doing. We feel that we can address that best, but the cities cannot make the regulations more lax. They cannot be less stringent than what the governor and the state puts forward.
Okay, and if you are in an area that's, let's say you're in Louisville and you have the Louisville mask order and the Boulder County mask order, which one do you follow?
whichever regulation is more stringent.
Thank you, Wayne.
So again, we're not encouraging municipalities to do this because it becomes very confusing for everyone. So we're trying our best to not have that happen.
Okay, it's a pretty specific question, but I think it gets to a bigger topic. We have separated party rooms and also booths that are physically separated by high backs over 5 feet. When we're open for business, will we be allowed to let a group of 10 people or less into each of the separate rooms? Will the high backs of the booths allow that as well?
Again, I think we're premature for being able to share that kind of guidance. I anticipate completely separate facilities or rooms, where there's a complete separate enclosure will be treated as separate spaces. So again, if there's allowances for people for dine-in, I think those types of settings will allow for, again, multiple settings to take place. That's kind of what we're, okay. Thought I lost connection there, but you were just sharing your screen. But yeah, so I think that's how some of the other sectors are being treated, so that where there's a distinct space, those are considered a separate facility. So we would expect similar applications within the retail food, but again, right now we have not seen anything from the state talking about any of that.
Okay. So as you can see, I did share my screen, and one of the reasons I did this was because we mentioned a little bit about posters that are in the requirements and some of the posters that are available to you. This was sent to anybody that has attended previous webinars, but there's a link on most of the chamber sites, the county site, and the Boulder Chamber site, to a group of posters that you can use. And many of the things that are called out in the requirements, things like avoid grouping or cough or sneeze, keep your social distance, wear a mask. They are branded without any particular municipality, and we're sharing them across Boulder County. There's one that says open for business, and this is the poster that Zach was referring to. This is the idea that if you are following the checklists and you're in self-compliance, that you can put this sign up on your window that kind of will be shared across Boulder County to say we're following the state and Boulder County's guidance and requirements, and we want to ensure trust in that to the public. So this is that poster. It is downloadable, printable, and 8.5 by 11, along with all these other posters. They are designed to be larger as well if you have a larger printer, but you can print them in 8.5 by 11. So I just want, and we have them in Spanish as well. So every poster has also been provided in Spanish. All right, another question for you, and I'll stop sharing the screen. Most states have enacted a 6-foot rule between tables. Would this mean the distance between guests at different tables, or is it to be measured by the closest point between 2 actual tables, regardless of where guests are positioned at those tables?
Again, we're not sure where the state will end up, but I would expect that you'll need at least 6-foot distance between the closest 2 people from tables, so that that would be the closest any 2 patrons from different dining parties would be able to be together. And I think as we move to those phases, we're going to try to provide some resources for people to look at their spaces and get ideas of how would I organize this, certainly to get as many dining options as possible, but still provide all the adequate spacing. So we, as we move to those phases, we definitely want to provide some resources for people to analyze their space and get a sense of what that will look like.
Okay. So I know I've heard this question a lot, especially from restaurants. How can they provide input and guidance for future orders?
That's a great question, because we're certainly eager to be able to provide that to the state ourselves, and there has not been a clear mechanism of how that's going to happen. That being said, I think we want these forums so that we can hear people's ideas and do our best to share that forward. But the state has not created a mechanism for input at this point. But we certainly want to hear people's thoughts, especially innovative ways that we can work with our attorneys within the language of orders that come out to offer lots of options for folks.
So you'd suggest to continue participating because future meetings, this one was a little bit more around the guidance, but future meetings may have direct opportunities for feedback and input into future orders.
Yeah, as much as we have influence ourselves. So we certainly want to hear from restaurants on what you're thinking, what you'd like to try to move into. We certainly know everybody would just like to go back to normal, but that, as Zach talked about, we're really far off from that. So we need everybody to be very creative in thinking about how you can address social distancing. Again, in restaurants, people aren't going to be wearing masks when they're eating. So we're really, really critical that we have all these other pieces and controls in place, as well as having a good handle on disease within our communities. So I think that's general messaging. The success of businesses is really the community. So if the community is not following all these different orders and social distancing and spreading disease, it will continue to have significant impact on our community and the businesses specifically. So it's really essential that we are successful, because everybody has a role in this being able to continue to evolve and get more and more relaxation of the orders.
Okay, just a few more questions about masks. We've gotten some questions about what are some of the reasons someone may not be able to wear a mask, so that people have a better understanding of some of the underlying health conditions that may not allow somebody to wear a mask. And then the second part of that is, if someone says, I can't wear one, what do you do at that point?
I'll take this one, Zach, if you want. Basically, you don't really need to probe any further. If they say they have some condition that prevents them from wearing a mask, you don't need to continue to ask them questions about what that condition is. But certainly anybody who has any kind of chronic respiratory issues, difficulty breathing, where a mask is going to further inhibit their ability to breathe and cause them stress, that's going to be an issue for them not to be able to have a mask. Someone who has severe claustrophobia or something like that, that would really, something that putting on a mask is going to really challenge them to a point where they're not safe mentally. Those would be other conditions. So it's really only to ask, hey, do you have is there a health reason why you cannot wear a mask? And if they say yes, you should, leave it at that for your patrons. And we're not asking you to police them. Again, if there's a really belligerent, someone who's causing a public disturbance, like any other time, if there was someone causing a public disturbance in your restaurant, that you would call law enforcement, you can still have that as an option. But just a general person who's saying, I can't wear it, and you don't have a right to ask me more questions, you should not continue to press them or call the police on them, because we aren't going to enforce on people who aren't able to wear a mask, and we're not going to ask them any more questions than you would to verify what their health condition is. And then was there another part to that?
Nope, that's it. I think another condition that's come up in some of are individuals on the spectrum who can't handle certain fabrics or so forth. So, and especially youth. We have another question that came in. What does the data show for the past 2 weeks since we were in the stay-at-home order or mode, and has there been a downward trend?
I can give you just a general idea. I don't have day-to-day in-depth knowledge on that, but I do get some reports on that. And I know prior to this last weekend, we were seeing very good trends in Boulder County, where our overall case reporting was declining. I think it increased over the weekend of reports. That's not likely related to the order going into place. Again, people get exposed and it takes a while for them to get sick and then have symptoms and ultimately get reported. So that was probably a condition prior to those orders going into effect. But again, we keep tracking that. I know we're doing fairly well in Boulder County relative to the state. Denver and Weld County actually is the worst rates within the state. And that's largely because they are not adhering to the public health orders. So I think there's a direct correlation there. Denver, I think, is doing as best job they can. They're just a very large urban center. So it isn't surprising that they have higher incidence of disease because of just the volume of people and those challenges.
Okay, and in the chat box, I put a link to the Boulder County data site. that allows you to see current numbers in the Boulder County, and it usually is only a day lapsed on that, so you can track that data as well. Are
And
there?
the
Oh, go
state,
ahead. Terry.
the state has similar resources if people may live in other counties and work in Boulder County or vice versa. So you can see what's happening within the entire state. And there's GIS maps, I think, also that can provide you different sorts of information.
Are there any other questions out there? Okay, Lane, do you want to wrap up maybe a little bit about the survey we'll be sending out to everybody about face masks?
Yeah, we're very interested in hearing from all of you on what you're seeing. Are you seeing challenges with patrons not wearing masks, and specifically not because of a health condition? They're just people saying, I just don't want to wear one, or, you know, just refusing to respond to you if you're challenging them about not having one. And then social distancing. Again, hopefully, at least in restaurants, you shouldn't have very many people, and that should be very managed right now under what is allowed. But grocery stores, we know, is a very different component. So are people seeing problems both with masks as well as social distancing? So we're very interested in this. This will also be, I think, a critical piece of information on helping us know that whether or not we can continue to relax orders. Again, if their compliance is very poor and our disease is increasing, it's less likely that the restrictions can be relaxed if the efforts right now are not successful. So it's really important for these things to go well. And so we really want to hear from you what you're seeing out there. And then we obviously have our data on hospitalizations and other disease tracking. So we'll be working with the chamber to blast out those surveys. We'll probably do them a couple times just so we have a couple different check-ins over the next several weeks that can help inform those decisions of what happens around May 26th and moving forward.
Great. Well, thank you, Zach and Lane. We want to thank everybody for participating today, for asking your questions. Continue to participate in these 1 o'clock calls. If we're going to be asking for any type of feedback, we'll try to send that out beforehand so that you know that you'll be on the call and she should be providing information. I will send out an email with a link to this recording as well as some of the resources discussed today. Everybody have a wonderful afternoon and stay healthy and safe.
Thank you to the chamber, and thank you for everyone for participating.